Okay, so today we are going to be discussing primary and mixed dentition.
What chapters are this, Miss D?
I'm sorry?
What chapters are this?
16?
Okay, thank you.
I had to look that up too. And then we're going back to chapter 7 a little later on. I moved anomalies to the end instead of the beginning. So we've got our learning objectives. All right, so let's talk about some definitions. We've got our deciduous or primary dentition. What are some of the other words you can use for deciduous or primary dentition? What have you heard?
Baby teeth.
Baby teeth.
Milk
Exactly.
teeth.
Have you ever heard milk teeth before?
Yeah.
That's an old term, milk teeth. So these are the baby teeth. The deciduous teeth, just like the trees, deciduous trees, they lose their leaves, or the primary dentition. Our focus is to not only be able to identify them, but as dental hygienists, we need to educate the parents on the importance of these deciduous teeth. A lot of people think, oh, they're just the baby teeth, they're going to fall out. It doesn't matter. And it doesn't matter that they have tooth decay. It doesn't matter what they eat or drink. They can take the apple juice to bed, that type of thing. But we really do need to educate the parents before the teeth even erupt on the importance of what these baby teeth do. And then we've got our permanent teeth or secondary or adult dentition. So primary, deciduous, or secondary and permanent. Now, the other word was succedaneous. You haven't heard that term in a long time. Do you remember what succedaneous is? Well, I'm not going to put you on the spot. That's going to come up. So we are going to go over the different definitions. We're going to go over also how these are numbered and what the functions are. So we've got our deciduous dentition, and that's composed of all of the primary teeth or the baby teeth. The primary teeth are shed, they're exfoliated, okay? They're shed and they are replaced by the permanent successors. So the process of all of this is called exfoliation. Exfoliation, you need to know that term. And that happens with the root resorbing at its apical end, and it continues to resorb until the entire root is resorbed or dissolved, and then the tooth falls out because there's nothing holding it in. So those of you that know what baby teeth look like, the deciduous teeth, when they fall out of the mouth, there's no root there because they have been resorbed. So it's the first set of teeth the child usually gets. Now, sometimes a child is born with teeth in their mouth, a couple teeth. That is not considered part of the primary dentition because those teeth are going to be lost. But it's the first set of teeth. And you need to know how to identify them with the universal continuous system. You need to know how to do that with the Palmer as well. So this is something that I've told you. I do not know these letters by heart. I know it's A through J, K through T. I know C is the maxillary right canine, but after that, I have to start using my counters. You know, I have to count them. So what I do is I have something like this that is taped in my operatory so that I can have a ready reference to, because it just takes time if I'm having to count. So A through J, K through T, FDI, Palmer. Now FDI, which one is that? Which system is that?
International?
That's the international system. So is that, do you use the cross hatches, or does every quadrant have a number to it?
A number to it.
A number to it. All right. So this is going to be 5, 6, 7, and 8. And the nice thing is when we get into the deciduous teeth, you don't have a tooth number 51. So it's easy to know that you're talking about what quadrant and that it's deciduous. Now the palmar is going to be a little bit different. We're going to get into that. All right. So just know you're going to need to convert. There are 20 deciduous teeth or primary teeth in the primary dentition, 10 teeth per arch, 10 on top, 10 on the bottom. And they include different classes or types of teeth. So you've got incisors, canines, and molars. So what is missing? The premolars. And this is something that's showing you nice spaces in between these teeth here. And this is what you want to see when you're looking at little Johnny or little Susie coming in. You want to see nice spaces between the teeth. So you've got a total of 20 teeth. Incisors, 2 on each side. So a total of 4. On top, a total of 4 on the bottom. Canines, 1 on each side, and molars, 2 on each side. There are no premolars. Remember that term succedaneous? So succedaneous are teeth that erupt and replace other teeth. So with that, all of those baby teeth, the deciduous teeth, are replaced by permanent teeth. So the incisors are replaced by, the deciduous incisors are replaced by primary incisors. The deciduous canines are replaced by primary canines. And the primary molars are where the premolars come in. So those are all succedaneous, but your first molar, second molar, third molar in the permanent dentition erupt distal to those spaces. So the 6-year molar, the first molar, erupts behind all the deciduous teeth. They are not succedaneous. They don't replace anything. What is the function of primary dentition? The same as all the other teeth. Chewing or mastication, they support the lips and the cheeks. They help form speech. It gives our tongue someplace to go, our lips also, so we're not whistling. And it maintains arch space and room for the secondary dentition, for the permanent dentition. And space is one of those really critical factors that we're going to be talking about. Adult crowding can happen if the deciduous teeth are removed too early for whatever reason. So this is really critical for the space maintaining aspect of things. The development for primary and secondary teeth, you need to know what some of the times of emergence are. You will be writing down the crown and root development for the permanent teeth as well on your tooth drawings. You're going to get into more of this in histology, so I'm not going to dwell on it. You do need to know what the approximate eruption schedule is. In every board that you will take for dental hygiene, it's going to have a panoramic image or a periapical of some sort and ask you what age this child is. And it's always going to be a mixed dentition. Susie, Johnny's coming through, coming into the chair. You need to kind of know also what is happening and what is coming next. Do they need sealants? Do they not need sealants? This tooth has, the deciduous tooth has a large cavity in it, but it is asymptomatic. Does that teeth tooth need to be restored? Does it need to be extracted, or do you just leave it? You're the first person to be discussing this with your patients or the patient's parents. So the eruption pattern is important, and it's a sequence, okay, because there's plus or minus. So you're going to see children in the chair at 4 years of age that have their mandibular central incisors that are permanent, as well as their sixes erupting. Everybody's a little bit different. So that's why we have, we've got ranges. But the primary crowns begin to form at about 6 months in utero. Now, that's what I want you to know. 6 months in utero, primary crowns. The crowns are complete at about 10 months after they start forming. So it's not saying that at 10 months, all the crowns are formed. At 6 months, those mandibular anteriors are starting to form, and about 10 months after that, they are completed. Root formation takes place during the eruption process and emergence. This is just like the permanent dentition. The roots are not complete. The roots complete, though, about 1.5 to 3 years after emergence. 1.5 to 3 years. What is the root completion time for permanent roots?
2 years?
2. Yep, 2. So it takes a little bit longer for the baby teeth or the deciduous teeth to have their roots completed. Then exfoliation, the active of those roots being resorbed and replaced with the permanent or succedaneous teeth, happens at about 6 years of age and goes to about 12 years of age. So these are the important dates that you need to know. The secondary crowns, the permanent crowns, begin to form and calcify at the beginning at birth, okay? And those first molars is, okay, mandibular anterior first molars through 8 to 10 years of age. And that 8 to 10 years of age is for those wisdom teeth for the third molars. The crowns complete calcification at about 3 to 4 years prior to eruption. And the roots are completed 2 to 3 years after emergence. Okay, so it's usually about 2 years. The order of the primary teeth, this is easier for parents than not parents because they've seen their kids go through this. The mandibular central incisors are usually the first to erupt at about 6 months, plus or minus about 2 months. Then the second to erupt are the other incisors. The maxillary laterals are usually the last. So there's really no set. You've got your mandibular anterior, those 2 teeth, and then the other 4 can come in any which way. We like to think in our way of thinking that it's going to be the mandibular central incisors, then the maxillary central incisors, then the mandibular laterals, and lastly the maxillary laterals. Well, once those 2 mandibular centrals come in, it's a free-for-all. The laterals, maxillary laterals, are usually the last. Then you've got your first molars. So how old is that child when those first molars start coming in? You remember?
6 years old?
Well, no, we're talking deciduous teeth here. So these are all just the baby teeth. So the first year molars or the first molars of the deciduous are called 12-month molars, first year molars. Those are the lay terms because most children are about 1 year of age. Then you've got your first molars, then the canines, and then the second molars, which are called your 2-year molars. So lay terms, the first year molars and second year molars, or 1 year molar, 2-year molar, if you need to remember that for timing. This is something really nice when you're making your oral health education book next semester to have something like this in your book so you can talk to a parent or you can talk to the child on what's going on underneath what they can't see. So prenatal and infancy is on the left, and then early childhood is on the right. So this really does, in one picture, can show the parent what's going on and what is being formed and where their permanent teeth are in relation to their baby teeth. So you can see for this is 2 years plus or minus 6 months, plus or minus 9 months, plus or minus 9 months. And then for the formation of the teeth, it's got a tighter plus or minus. Okay, you don't need to know that. Primary dentition, the actual dates are not as important as the eruption sequence. Because even though there can be a great deal of variation in the actual dates, the sequence of eruption tends to be more uniform. What falls out first, what comes in first, that type of thing. So the deciduous teeth, what are some of the important factors to know? They maintain a place for the permanent teeth. The maxillary and mandibular bone continues to grow, and deciduous teeth develop spaces between them. They're called primate spaces. You want to see spaces in between those deciduous teeth. The spaces between the deciduous canines and the first molars and between the first and second molars are called leeway spaces. They're primate spaces, but they're also leeway spaces. So you might see or hear both terms. In the anterior teeth, they're primate spaces, but from the canines back, they're called leeway spaces. So for primary dentition, the mandibular central incisors are often the first teeth to erupt. That occurs at about 6 months. You can see kids 4 months of age with them. You can see kids as old as 10 months just getting them. And then after that, the further eruption of the rest of the primary dentition follows. So the primary dentition takes anywhere between 2 and 3 years to be completed, beginning with the initial calcification of those primary mandibular central incisors and later being completed with the root formation of the primary maxillary second molars. Now remember, the mandibular molars are going to erupt before the maxillary molars, and those are your quote unquote 2-year molars, and root formation can be about 3 years after that. There could be a lot of staining when these baby teeth first erupt in the mouth, and parents are concerned about that. And this staining is thought to be attributed to the Nasmyth's membrane, and it's oftentimes a green-gray residue that consists, that's actually fused tissue, and it's the reduced enamel epithelium. You don't need to know this because you're going to get into this in histology, but it's part of that oral epithelium and that dental cuticle that's placed by the ameloblast, and it easily picks up stain from food and other things. So these babies are eating strained carrots, they're having vitamins with iron in them, so it's not uncommon to see stained teeth when you first see them coming into the mouth. Parents are more concerned about it than anything because they think that they're doing something wrong. The masticatory surfaces, the teeth that join other teeth, may show significant attrition as a result of bruxism or grinding. Kids grind their teeth. Almost all kids, you're going to hear it. And it is really bone crunching if you've never experienced it. It will wake a parent up and take them into their room to find out what in the world is going on. One of the thoughts on grinding with deciduous teeth with these kids is that it helps stimulate osteoblasts, which will help in turn help the jaws grow. So we don't know why kids grind, but they do. And that is one of the rationales as far as why we think they grind. Also considered normal in most child patients are those interproximal spaces. Now remember, those are the primate spaces in the anterior, leeway spaces in the posterior. But you want to see those spaces because that space is necessary for proper alignment of the future permanent dentition. Those permanent teeth are much larger than the primary teeth. So they need space. So this is a model that's showing a 3-year-old. A 3-year-old has the first molar, their 12-year molar, and their 12-month molar, 1-year molar, and the 2-year molar here. And you can see the permanent teeth starting to form. This is not a true accurate because if this was the 2nd-year molar, guess what? The roots would not be completed. You will need to be determining primary versus secondary dentition, mixed dentition. The primary dentition is exfoliated or shed and it's replaced by the permanent dentition. When that first tooth falls out and the permanent tooth starts coming in, they are then considered to be in mixed dentition. What is the biggest giveaway that these are permanent teeth and not deciduous teeth?
The mamelons.
The mamelons, exactly. Yeah. And the mamelons are formed from how many lobes?
4.
3 lobes.
The mamelons are formed by 4 lobes. 3 lobes, 1, 2, 3. And the cingulum is formed by that 4th lobe. So the primary tooth is shed or lost. Okay, it's exfoliated. And then the succedaneous permanent tooth comes in, oftentimes lingual to the deciduous tooth. So the process involving shedding of the primary tooth consists of those osteoclasts. Remember, C-L-A-S-T eats away. Okay, so they absorb the alveolar bone between the 2 teeth, and then you've got odontoclasts, which cause the resorption and the removal of the primary root. So this is typically what you'll see when a baby tooth falls out. The root is resorbed. There's nothing to hold it in. It's wiggly. They wiggle it and it falls out. So the order of emergence of the permanent teeth, secondary teeth, they start usually at about 6 years of age, hence the 6-year molars, and go into the late teens to early 20s for the wisdom teeth. So the first permanent teeth that start to erupt are the first molars, generally the first molars. And the kids don't even know that they're coming in. The parents don't know that they're coming in. They're behind all the baby teeth. But then it's about the same time that those mandibular central incisors are getting loose. So those are happening simultaneously. Then you've got your other incisors, just like the deciduous teeth, other incisors. It can happen in any sequence. Then you've got your mandibular canines, followed by your premolars. Now, what deciduous teeth are being shed for those premolars to come in?
Molar.
Just molars.
The first and second deciduous molars, exactly. So that's about 10 to 12 years of age. Then the maxillary canines. Then your 12-year molars or the second molars. So the thing that's different here is you've got your canines and then the second molars. But is it really different from the deciduous teeth? No, the sequence is still the same. It just is in different years. When those two front teeth, the top front teeth, maxillary front teeth start coming in, that's when we call the kids, forgive us, but we call them that ugly duckling stage because they've got this small face and these huge teeth, and they haven't grown into their teeth yet. And these huge teeth are generally misplaced. Now, would you be able to tell that this might be a 9-year-old? How old is this child? So, what are you looking at? You're looking at the central incisors. Are those they're permanent? Are the roots complete or not? You're looking at the first molars, which are your 6-year molars. The roots are completed. So it's 6. Okay, if they got them when they were 6, 7, 8, 9. Okay, 2 to 3 years. After that, the deciduous molars have not erupted yet, and they're still in the process of root exfoliation. So you're putting those hints together to come up with their 6, 7, 8, 8, okay, but they're younger than 12 because they've got their second molars aren't even close to be erupting yet, but they're getting there. And 10 to 12 is when these premolars erupt. So you're putting all that information together. Have I made you want to cry yet? How old is this child? All right, it says 8 years old. Would you be able to tell? 6-year molar, 7, 8, 9. Okay, so it's not 3 years yet for those roots to be complete. So that would be the first thing that I would look at, would be root completion. Now, when you get questions, it's not going to ask you, how old is this child? They're not going to be expecting, I'm not going to be expecting you to say 8 years, 2 months, and 3 days. You could say 8 to 9, you could say 7 to 8, you know, I mean, and it's all good. It's all good because it's that range. So how can you tell a deciduous tooth compared to the primary versus secondary dentition? The deciduous teeth are smaller than the secondary tooth with the same name. They are whiter in color. They're very white compared to the dull yellow looking permanent tooth that is erupting next to it. Now, the permanent teeth aren't yellow, they're just yellower, more yellow than the deciduous teeth. So in contrast, you've got this very white deciduous and this darker, yellower permanent tooth. The contrast shows up more. They have a very pronounced CEJ constricture. I'm calling it the waist. They've got a very pronounced CEJ constricture. And they have pronounced cervical bulges. They're very curvy teeth. All right, this is the cervical bulge here. You're not going to be able to see it, but you can see it a little bit here. They're very curvy teeth compared to the permanent counterparts. The primary teeth are smaller. The enamel is whiter than the permanent teeth because of increased opacity of the enamel that covers the underlying dentin. All right, so the baby teeth are whiter. There's a cervical ridge that's present on both the labial and lingual surface of the anterior teeth and the buccal surface of the posterior molars. They're very curvy. They have relatively long roots compared to the crowns. The enamel is thinner. They have more wear, attrition, because they're less mineralized. And for the deciduous teeth, there's fewer anomalies. Now, would you be able to tell that this is a deciduous central incisor or a permanent central incisor? You have sharp angle, curve, but look at the root, the crown to root ratio. Remember on the maxillary anteriors, the central incisors are almost equal, very large crown compared to the length of the root. So they have these deciduous teeth have these cervical prominences that give the crowns the bulbous, curvy appearance. They have a narrower occlusal surface, buccolingually. They are whiter in color. Sometimes they'll have a bluish cast to them because you can see through them. The pulp chambers are very large compared to the permanent counterparts, large pulp chambers, and their pulp horns extend high and they're closer to the enamel. So the dentin thickness also between the pulp chamber and the enamel is thinner. So they've got thinner enamel, less dentin, and huge pulp canals, huge pulp canals. Because the enamel and the dentin is thinner, primary dentition has a greater risk of endodontic complications, okay, root canal complications. Because the pulp chamber and the pulp horns are larger, there's an increased risk of pulpal exposure during a cavity preparation. And those of you that have worked in peds know this. The dentist is going in and they're removing the decay and they're prepping the tooth. Well, guess what? They're going to see a little pink here. That's requiring what we call a pulp capping. So we've got interproximal decay. Look at how fast this decay is spreading compared to that. Decay spreads faster in deciduous teeth. The roots of the primary teeth are narrower and longer compared to the permanent counterpart. And the crown to root ratio of the primary teeth are smaller than the ratios of the permanent dentition counterparts. You've got long crowns and you've got them spread apart compared to the permanent counterparts. The pulp cavity, we said, you've got a larger pulp cavity. It's closer to the surface of the tooth. You've got thinner enamel that's less mineralized, thinner dentin, which is partially mineralized. So decay is going to spread faster and end up with pulp considerations, endodontic considerations. More so in the deciduous than the permanent counterpart. So let's compare the primary versus the permanent counterpart. So this is an anterior tooth here. Okay, you've got a curvy CEJ and a curvy CEJ on both. You have a straight mesial, but what you don't have are mamelons in the primary. They're smaller, and the root can be much longer compared to the permanent counterpart. For the deciduous molars, look at that cervical bulge. Look at the space between the roots. And do you notice the root trunk? Much longer root trunk in the permanent. Let's take a look at the anterior teeth. They have a prominent lingual cingula. Okay, the cingulum is very prominent. There's no labial depressions, no mamelons, no perichymata. The anterior roots are thin. And this is something different. The anterior roots bend labially in the apical third. They bend labially in the apical third. Is there any bent root in the permanent counterparts? And if it does bend, which direction is it going to bend in?
The distal.
It's going to bend towards the distal, not towards the labially. So when you're looking at this, if you're just asked to identify a picture, look how curvy this is, okay? And then look at the bend there. For the molars, you've got prominent cervical ridges or bulges. Again, they have very distinct curves, a exaggerated CEJ. The crowns taper narrower toward the occlusal because they have a narrower occlusal table, and they are wider mesiodistally instead of occlusal gingivally. The architecture, the occlusal anatomy, they have fewer grooves and depressions. They're not as geographic. The second molars are larger than the first molars. We're talking deciduous. And the enamel rods slope occlusally near the CEJ. Now, we don't need to know that. But, okay, the second molars are larger than the first molars. What is one of our general characteristics for the permanent dentition? The first of a certain class type is generally larger than that of the second and the third. So this is going against that. The root furcations are closer to the crown. You have a very short root trunk. The roots are thin and slender, and the roots diverge. They're spread farther apart to make room for the forming adult premolars, because that premolar is going to be housed in that trifurcation area, the crown of that premolar. So let's take a look at each of the individual class types. They're very curvy. The roots have a facial bend to them. There's no mamelons that are being shown. So you've got 4 primary incisors, maxillary,
Misty,
mandibular. Yes.
I'm a little bit confused because I thought the mamelons were a trait that would only be on primary teeth.
No,
Like
they're
the
only on permanent.
So what are the ridges at the end of the, like the baby teeth on the incisors?
They don't have any. They're generally smooth.
Okay.
Yeah, but they're not called mamelons. Okay, mamelons are those from the 3 lobes.
Okay.
Both the primary incisors resemble their permanent successors with some exceptions. Okay, the curve, the bulges. They have the same arch position, the same function, and the same general shape of their permanent counterparts. It's very hard to find deciduous teeth that have been extracted that still have their roots on them. For the deciduous incisors, they are longer incisal cervically than mesiodistally, except the maxillary central incisor. This is those things that I'm not forcing you to remember, but okay, that maxillary central incisor is pretty wide. They're smooth surfaces with minimal depressions. Their roots are, in comparison, longer for that crown to root ratio when compared to the permanent. From the lingual view, you've got that prominent cingula. You have those marginal ridges that are most prominent on the maxillary central incisors, and they're less distinct on the mandibular. So that is just like the permanent counterparts, right? You're going to have more anatomy on the maxillary than you do on the mandibular. CEJ curvatures, greater on the mesial. The roots bend facially in the apical third. And the maxillary central incisor roots may also bend lingually in the cervical half. So they're shapely teeth. The central incisors, would you be able to look at this and determine, is this a permanent or a deciduous?
That's permanent.
It looks very similar, doesn't it? Okay, it's actually a deciduous.
Because the root is longer than the actual crown.
The root is very long. Look at the cinched in CEJ. It's very exaggerated.
But usually we wouldn't have the pericymata on the facial side, right, Ms.
Correct.
Lee?
Correct.
Okay.
And look at how curvy this is. Now, if they had this root with more of a bend, it would be a dead giveaway. Look, you even have that distal lingual twist. So there's subtle differences. The length of the crown to the root is one of the big ones, and then the other one is the curve, the bulges, is what I would look for. So these central incisors, I'm mixing up a couple textbooks here. From the labial aspect, the crown of the primary maxillary central appears to be wider. Okay, it's a wider tooth compared to the permanent. It's the only anterior tooth of either dentition with this crown dimension. Trivia. The mesial and distal outlines are a little more rounded than the permanent. They're a little more rounded, but you can see that the mesial still has a sharper angle than the distal. And the incisal outline is relatively straight. But it slopes towards the distal with attrition. So, but look at this one. This has that incisal straight versus this one has that distal lingual twist. Different textbooks, same tooth. Very curvy. From the labial aspect, you don't have mamelons. You can have imbrication lines, but you might not have the pericomata, which is going this way. From the lingual aspect, you've got well-developed marginal ridges. This is the marginal ridge here, and this is the marginal ridge, and then you've got your fossa. Well-developed cingulum. The mesiocervical curvature is greater than the distal cervical curvature. That's yet another way of saying the mesial CEJ curves more than the distal CEJ. Maxillary centrals much wider. The mandibular incisors are almost equal. So the lateral incisors, deciduous or primary maxillary lateral incisors, they're smaller and the root is longer in comparison to the central counterpart. Mandibular centrals. That's the first thing I look for. Primary mandibular central incisors. There might be some slight grooves that are available, or visible. Mamelons usually are not present though. Long crowns or long roots compared to the crown. The central incisor is very symmetrical, as it is both deciduous and permanent. Central incisor, very symmetrical, straight incisal edge. The lateral incisors are a little bit similar than the permanent successor as well. Look at this slope, that distolingual twist. It's not completely symmetrical. It's got a little bit of a incisal slope. So that is very similar to the permanent counterpart. The bulges are a little bit longer, and if this was truly something that wanted to depict deciduous, they'd put a little bit of a bend there. The cingulum is offset because of that distolingual twist. The root may have a distal curvature in its apical third, and it usually has a distal longitudinal groove. I'm not going to ask you this. For the mandibular incisors, the root of the lateral incisor is longer and narrower and more tapered than the central. The lateral has that distal longitudinal groove and a mesial depression running lengthwise. And what is the purpose of those root grooves?
Increases surface area.
Thank you. Increases surface area. The canines. Curvy. Curvy, curvy. You've got 4 primary canines, 1 in each quadrant. They have a prominent cervical ridge that's present on both the labial and the lingual surfaces. Long roots. They taper. Sharp cusps. Long roots. They can look like the permanent counterpart, except for the shapeliness of them. If this was a permanent tooth, this would be a sharper. So from the contact areas, what's unique about the maxillary canine is the contact of the maxillary canine is more cervical than the distal. I'm not going to make you know that. But the contact areas are different. The root is twice as long as the crown, more slender. If there's a bend, it's going to bend distally, unlike the incisors. It's a wide tooth. There's a cingulum present. Mandibular. The dimensions are a little bit different compared to the maxillary. And look at this. This is when I'm talking about, I want to see a straight mesial on your canine, mandibular canine. That's what I want to see. I'm going to take that away because I messed it up. I want to see a relatively straight mesial. If this was a maxillary canine, it would be more like that. Straight mesial. The maxillary is more anatomically complex with marginal ridges and a cingulum than the mandibular. Usually the mandibular just has a fossa and no lingual ridge. Oftentimes S in shape. The incisal ridge is centered. It's a nice straight up and down tooth. Curvy CEJs. The roots are bent labially in the apical third for more anchorage. They're wide teeth. And the molars. How curvy these CEJs are. Look at the bulges. The cinched in waist. the space between the roots. Three roots versus two roots, top and bottom. All are wider mesiodistally because the premolars need to have space to replace them. You have 8 primary molars, got a first molar and a second molar in each quadrant. Both have a similar arch position, function, and general shape as the permanent counterparts. You again have those prominent buccal bulges. Curvy. Cervical lines curve apically. All right, we're going to talk about the primary second molar before we talk about the first molar, okay? Because the primary second has a lot of characteristics like the secondary first. It mimics the permanent first molar. Can you see the similarities? Tiny little cusp of carabelli there. All right, you've got a distal lingual cusp here. All right, you have a nice wide occlusal table. This is the permanent 1, 2, 3. And the primary second molar, 1, 2, 3. So the primary second mimics the permanent first. Primary second molars resemble the adjacent secondary first molar in that arch distal to them after the age of 6. The primary second molars are smaller than the permanent first molars. So this is, okay, we've got premolar here, but on the other side, we have, this is a premolar, right? This is the primary second molar, and this is the permanent first. They look very similar. One's a little bit larger than the other. And you'll see some kids come in with huge deciduous teeth, and it's really hard to tell the difference. For the maxillary second, you've got your cusp of carabelli, your oblique ridge. But look at the difference in the roots. Wide spread apart. Short root trunk. Cusp of carabelli. It's really a tubercle, poorly developed. The mandibular second molars, the primary mandibular second molars, look at the occlusal. This occlusal looks just like the occlusal of the permanent first molar. It's not until you see the mesial and distal that you can see the curves. You can see the very short root trunk. You can see the bulges, the cervical bulges, that will distinguish it from primary to secondary. But just from the occlusal, it looks identical. From the buccal aspect, you've got 3 cusps. The crown is very similar. The primary mandibular second molar is very similar to the secondary mandibular first molar. They look similar. So the primary second mimics the permanent first. All right, so that's the big thing. If it looks like the permanent tooth, okay, if a deciduous tooth, if it's a molar, mimics the first permanent tooth, then it's the second primary tooth. That's the takeaway. Look at these first molars. The crown of the maxillary first molar does not resemble any other crown. But what does the occlusal sort of look like there?
Molar.
Sort of looks like a premolar, sort of. The tooth has an H-shaped groove pattern on the occlusal. Got a central groove. For the maxillary first molars, you can have 3 or 4 cusps. So there's some variation. So this is from a different book. The occlusal view of the primary maxillary first molar somewhat resembles a maxillary premolar versus the primary mandibular first molar resembles no other tooth. Well, which one is it? We are going to go with the primary maxillary first molar may resemble a premolar versus the primary mandibular first molar, okay, resembles no other tooth. This is the slide that we're going with here, is the primary mandibular first molar resembles no other tooth, because this might resemble a premolar occlusal pattern. Got your H pattern on the occlusal, similar to a premolar. But look at this mandibular first molar. It's unlike any other tooth in either dentition. And that's the takeaway of the mandibular first molar in the primary dentition. Unlike any other tooth. 4 cusps, more CEJ, more prominent on the mesial than the distal. The primary mandibular second molar is larger than the primary first molar because it needs to have space. The tooth most closely resembles the form of the permanent mandibular first molar. Now, this is for the second molars. The primary second mimics the permanent first. Okay, 3 buccal cusps, just a different picture. 1, 2, and then the distal. Mimics the second primary, mimics the permanent first. Groove patterns. Do you seal deciduous teeth? Absolutely, especially if the child is going to cooperate. I'm a dental hygienist. My child had all of her deciduous teeth sealed because she had no choice. She was in the chair, she was told to open, and she did. Remember, those pulp cavities are very high. There's thinner enamel, thinner dentin. Decay is going to spread faster. Those pulp chambers are very high compared to the permanent dentition. So whenever the doctor is preparing a tooth, it's not uncommon to have a pulpal exposure. Okay, you've seen this before, but how old is this child?
This one around, I
9 years old.
think this one was around 3.
3 or 4?
Okay, this was the picture of the 3-year-old because these are the permanent incisors here. Okay, so these are the permanent incisors. They haven't started to resorb the roots yet. This is the 1st-year molar. This is the 2nd-year molar. And this is the first of the permanent molars. So they're younger than 6, okay, way younger than 6 because the roots haven't even started to form yet. So they're 2, if this is the 2-year molar, they're 2, 3, 4, okay, because the roots, this is showing that the roots are formed. 3, 4, 5. So you could say 3 to, it would be the younger age of that. If it was a 5-year-old, these teeth would be more here and you'd start seeing some root resorption. What do you think? Do you remember? This is the 1st molar here, permanent 1st, permanent 2nd. Take a look at these roots. Are they completely formed? Not quite.
7.
Yeah, 7 would be good. 8 is what the picture said,
Okay.
you know, but we've got a range. What's your guess? These are the permanent incisors. Root is starting to get resorbed on the deciduous molars. This is your 6-year, your 1st permanent molar here. So this is a permanent molar with the roots completely formed. 12-year molar, not even erupting yet.
9?
9.
Yeah, 9. You guys remember the picture. So this is what you're going to be faced with when you go into clinic, and you're going to be the one that has to chart what is permanent, what is deciduous, what is there, what is missing, and you're going to be pulling your hair out, especially with the first couple of these that you see. So what teeth are these teeth here?
Deciduous.
I'm saying they're permanent because they've got a molar, and another molar here. They have a premolar. This is a premolar. So these are number 8 and 9. What tooth is this one? What are these?
Canines.
What do they look like?
Canine.
They look like canines, and that's exactly what they are. They're canines. Guess what, folks? Where are the laterals? We don't know. So we've got a canine. This is a premolar. This is a deciduous molar that looks very much like the permanent first molar. Second deciduous molar looks very much like the permanent first. So you can see how it can be confusing. But once you see mouth after mouth after mouth, you're going to be able to pick this up. So it's recommended that the first dental visit occurs within 6 months of the eruption of the first primary tooth. So how old are they then? They're 6 months old or thereabouts. Is a child going to be sitting in the chair for you? Absolutely not. Are we going to do anything if we see something wrong? Absolutely not. But what this is doing is it's just giving us information and having us have an additional time to educate the parent on this is what you should be doing. For periodontal conditions, most kids have gingivitis if they have anything, but there's something called early aggressive periodontitis that used to be called juvenile periodontitis in the past. We call it JP, but the classifications have changed a couple times since I was in school. And that's where early intervention is really important. So we need to be taking radiographs. We do need to probe. Now, do you probe in school? We only probe permanent teeth that have fully erupted. But if you're suspecting anything, you're going to be taking periapicals, because this is what can happen at a very early age. They're losing teeth at the age of 12. Very fast bone destruction. Okay, that is everything you need to know about primary dentition. Any questions?
I have a question, Ms. Lee. I think you mentioned something about attrition, and I don't remember what you said about that. Is that a good thing that
You're
kids
going
do?
to see kids grind, all kids grind. And sometimes when the teeth are ready to exfoliate, they just have tiny little nubs. They've worn all of the enamel down to where you can barely see their deciduous teeth. That's okay. You know, we're not making night guards for them. We're not doing anything for them. Again, the theory is that it is encouraging bone growth, jaw growth, as well as these kids, when they sleep, their mind is still going. They're still going. They're on the hamster wheel. Even
Okay.
when they sleep.
Misty, for the early aggressive periodontitis, is that just due to lack of oral?
No, that's oftentimes there's a genetic component to that, as well as certain types of bacteria that has been found in them. And there's very clear-cut parameters. The anterior first, teeth and the first molars, that is localized aggressive periodontitis versus aggressive periodontitis. And we're going to learn more about that next semester in perio. Okay, let's take, if it's okay, I'm going to use all your time. Let's take a 5-minute break. We'll come back. We'll discuss anomalies. It's going to go very fast because you've had all of it already.